Hello, Mary.
Oh, hello, Mr.
Hi.
Krishna.
Hi. Come and have a sit down.
You.
There you are.
Thank you.
Take a seat.
Thank you for coming to talk to us.
You're welcome. Yes.
And so, tell me about yourself. Your name's Mary.
Ellis.
Okay. And
yes.
how old are you now?
I'm 83 now.
83. Wow.
Yes.
And you're Elizabeth.
Yes, I'm her daughter.
A daughter.
Yes.
Okay. So, Mary, we're going to go back to when your back problem, first started.
Yes. 2 years before I had my operation, which was in May.
May 2010 was your
that's
surgery.
right.
Okay.
Yes. Yes. And I had lower back pain under the buttocks, and I had a couple of two strokes.
Okay.
One mini stroke, wasn't it? And then a seizure.
Okay.
And then I was asked to stay in hospital until they saw what was wrong with me, found out. And the doctor said she thought then, the way I was walking, it could have been spinal stenosis, because I wanted to walk that way and I couldn't. I had to walk the way it was sending me.
So you were off balance.
I was off balance, yes.
And you were in quite severe pain.
Oh, very bad pain. I would have to stand sometimes if I was going down into the village, stand and hold on to railings or a wall or anything until the pain went.
And Elizabeth, from your point of view, I mean, was it difficult to look after Mum? And
Yes, it was. I think she was certainly more restricted because she'd been very active up until that point, and then all of a sudden the pain was so severe that she couldn't go out, she couldn't do the things that she normally wanted to do. So going shopping even was difficult because she couldn't sit in the car for very long, and all the things that we used to do, go to the theatre, she could no longer do.
And you were on quite severe high doses of painkillers.
I did, I had painkillers, yes.
Particularly tramadol.
Yes.
Was that making you a little bit dizzy?
Well, it made me a bit sleepy, yes, and a bit dizzy. Yes,
okay.
yes.
So
And
now
I
it's
used to
quite
like
an interesting story how you found out
Yes,
about
it was,
me.
yes.
Elizabeth, do you want to take that up?
Yes, it was when Mum was in hospital having had her second mini stroke, and also they'd been looking into the pain and everything as well, and they decided that they would do an MRI scan to rule out various things, and it was on the MRI scan that they then discovered that she had the spinal stenosis.
Yes.
So I then contacted the Nuffield Hospital because Mum was still in severe pain, although she'd recovered well from the strokes. And I mentioned spinal stenosis to the lady on the telephone, and she said, we have just the gentleman for you, Mr. Krishna. And you were coming within literally a couple of days of my phone call.
Okay.
And she said, shall I try and squeeze you in? And I said, oh, yes, please. And really, that was the start of things.
Okay. And so we saw you and you had 2 epidural injections.
That's right, yes.
Which gave you about a month's relief each
That's
time.
Right, each time, yes.
Okay. And then you had surgery here at North Tees Hospital.
I came up, yeah, they didn't leave me very long. I said, well, I have a long wait. No, we'll see if we can get, you'll take your turn, but, and the lady, I belong to the WI ladies group in Strensel, and they said, Mary, I don't know how you dare. And I said, no, I'm going to have it done. But you were away at the time, weren't you?
Yes.
And so, is it Miguel?
Yes.
Yes.
And you had your surgery in May last year.
May last year, yes. And then, well, a lot of my friends came in after about a month and said, I'm surprised that you can get out of bed and walk and do, which I could. And I did. And I walked the first, walking in hospital.
Couple of days after surgery.
They had me flat on my back, or tummy, I don't know which, for 2 days. I said, I can't lie. She said, you have to lie still for 2 days. I said, I don't think I can, I'm fidgety. So they said, well, but I did. And I was in about 5 days, and I was up and about.
Okay.
I used to get up the same day. After 2 days, I didn't have to get out of bed. But after that, I got out of bed,
And how are you now? You're about 7 months from surgery.
Yes.
7, 8 months?
Yes.
How's it getting on? How are you doing?
Fine, thank you. Yeah, couldn't be better. I mean, really, I never thought I'd be able to get better like this.
Have you got any pain left in your back? No pain?
No, I might just have a little twinge occasionally on the top of my hip, but nothing compared.
And you're walking well?
Yes, yes.
And you're sleeping well?
I am, yes. Doesn't disturb my sleep.
I think this is a great testament to the fact that age is not a criteria or a barrier anymore to successful surgery.
That's right. Yes.
And just because you're 80 doesn't mean that you have to be written off anymore.
No, that's right. No. Yes.
And we can treat people as you're a good example, and people get their lives back.
Yes.
Well, I went on a holiday on my own, didn't I? Elizabeth and Simon, I said I didn't want them to miss their holidays. And so Elizabeth took me to Hemsley first, and I stayed there for a week on my own.
Very good.
And up and downstairs. There were no lifts there.
No, it was an old-fashioned
hotel.
And you're back to all your normal activities?
Yes, I do what I would normally have done before.
Well, thank you very much for coming today.
Thank you. Thank you, Mr. Krishna. Thank you.